right now, and I'm so sorry. So the directive from the public health law is that we work with our local hospitals to create a community health assessment. They have to create a community services plan, and then we come up with a community health improvement plan together, which aims to address the needs identified in the data analysis. So we were asked to choose priorities, and there were 5 of them that we could choose. So we examined our data together with the Siena College Research Institute. We conducted over 650 phone interviews and heard from our residents on what they said was needed in our area. And we also heard from you, our local community partners who work with the residents. So I will share some of those highlights today. We met with our Prevention Agenda Leadership Team, which was comprised of over 21 community partners, and also you folks here at the Healthy Ulster Council who assisted with the surveys and the direction of our CHIP. So it was quite the process, and here is an image of the front cover of the document and the web link to where it lives. We're really proud of it. It really, helps to inform a lot about how healthy we are in Ulster County. And so this is a sample of what one of the data points look like in the document. And this one speaks to how many residents there are to mental health providers. So in this slide, you can see that Ulster County in 2022 had around 270 residents per one healthcare provider, mental health care provider rather. So, we also identified from our residents and from you that there was a shortage. And we know that there is also a wait for people to sometimes see mental health care providers. So there's helpful gems of information that we collected, and we hope people utilize for program planning and improving the well-being of our residents. You'll probably remember seeing this flyer go around as a result of the 650 collected opinions of everybody. We learned that 92% of Ulster County residents think that it's completely true or somewhat true that people may have a hard time finding a quality place to live due to the high cost of housing. We also learned that 26% of the county residents think that it's not at all true or not very true that most people are able to access affordable food that's healthy and nutritious. 66% of residents responded that parents struggle to find affordable affordable childcare. 49% of Ulster County residents said that there are not sufficient quality mental health care providers, so almost half of us in that survey. 50% of the residents responded they don't believe that people can get where they need to using public transportation. So whether it's true or it's just a perception, that is something that, we need to work on. 98% of Ulster County residents with household incomes of less than 50K had not visited a dentist for a routine checkup or cleaning in the last 12 months. So this happened in 2022. We're not sure how much COVID had to do with it, but that's, really shocking that 98% of people missed their cleaning or their routine dental appointment. So we need to work on that. 50% of residents with household incomes less than 50K rated their mental health as fair or poor. And 46% of Ulster County residents with a household income of less than 50% rated their physical health as fair or poor. So those are some, things that we pointed out to the state and, took note of as we were developing our community health improvement plan. So then you'll probably remember this other survey. You all took part in this, and we are grateful. 40 responses were collected from providers that serve the various populations in Ulster County. And as a result, the survey showed that the top 3 issues that affect the health in Ulster County were access to affordable, decent, and safe housing, access to mental health care providers, and access to affordable, reliable public transportation. The survey also showed that the top 3 barriers to people achieving better health in Ulster County were drugs and alcohol use, knowledge of existing resources, and geographic location or living in a rural community. So there are a lot of other findings that are noted in our community health assessment. These data slides talk about what it is for the region of Mid-Hudson, but we broke it out for Ulster County as well. And so what was the impact of health issues? We saw that 52.6% are impacted by chronic diseases, such as heart disease, diabetes, asthma. 43% have health disparities, and 63.2% have mental and substance use issues. And then we have a regional perspective to look at. So along with looking at our secondary data sources from New York State Department of Health, CDC, emergency room visits, we try to figure out who in our county was addressing the different issues. And through our health inventory that some of you participated in, and we appreciate that, we found out who was working on the different evidence-based initiatives. And then thanks to Katie Sheehan Lopez, she helped us with this chart where we figured out of you all in this meeting, who was working on the prevention agenda aspects. And so you might see your agency in this little graphic here. So I'll just read that Lung Association, Red Cross, City of Kingston, Community Action are all doing things around chronic disease prevention. We know that maternal and women's health issues are being addressed by the IFH, other federally qualified healthcare centers such as Cornerstones, Planned Parenthood, and the Health Department. And so, this is all what we assessed, who's doing what in the county when we, came up with our CHIP. And so the state asked us to use this Excel template to put our action plans together. And that document also lives in the same place as our community health assessment. And it's located under research and reports on our website if you want to dig in. But our action plans center around 3 areas: prevent chronic disease, promote well-being, and prevent mental and substance use disorder action plan, and promote healthy women, infants, and children. So the hospital at Ellenville Regional is taking on the top 2, and also in the Westchester Health Alliance Hospital is taking on some in the top 1st, and then the 3rd, promote healthy women, infants, and children. And I'll show you a little bit more about that. It's complicated because they wanted us to come up with a lot of metrics for data that we were going to be measuring for each project. So I'm not going to go into it, but we had to come up with like short-term and long-term outcomes for each of our interventions. So for instance, under chronic disease prevention. The lead agency for this one is the City of Kingston and Cornell Cooperative Extension. And they had the means through funding source from State Department of Health on this Creating Healthy Schools and Communities program. And we're going to hear more about that from Kristen soon on the agenda. But we're, really excited because it's addressing nutrition and physical activity so that we can move the needle on that in our county. Another selected improvement plan indicator is with the lead agency of the Health Department and Tobacco-Free Action Communities. And so we have already a great law to help reduce tobacco marketing to youth, but we want to see that strengthened. And Vin might chime in here and talk a little bit about that.
Sure. That law was passed in 2015. It has a long title. It says a local law establishing a tobacco retail license and reducing youth exposure to tobacco. The main thrust of it is that even though tobacco companies are not allowed to advertise on broadcast media and what have you, they still spend $2.5 million a day in New York marketing their products, mostly at point of purchase. These are at the corner stores and convenience stores that kids tend to frequent a lot. And it's not really about compliance with selling tobacco products to kids underage, but it's the marketing that kids are exposed to, which is very powerful. I was formerly in the advertising industry on a professional level, and I can tell you that advertising is a very powerful tool, which is why corporations spend millions and billions of dollars on advertising. So basically, this law says that in order to sell any tobacco products in Ulster County, that in addition to the New York State license, you need a local county license, and no new licenses will be granted to any business attempting to open sell tobacco products within 1,000 feet of any K through 12 school in Ulster County. Now, there were a couple of compromises that were made when that law was passed on a political level. One is that existing retailers were grandfathered in that 1,000-foot zone around K through 12 schools, and they could actually transfer that license to new owners if they were to sell their business, and that cycle could happen as many times as they want, as long as it was in the same location. So what we proposed to do was to amend the law to eliminate that transfer of license. So in other words, once a business was sold or went out of business, that license gets retired. So that means that the quantity and density of tobacco retailers located within school zones would diminish over time. One of the other things that we wanted to add to it, and this may be preempted, maybe, because Governor Hochul just announced that she would be pushing for the state to pass a law to ban the sale of all flavored tobacco products. Currently, flavored vaping products are prohibited, but flavored tobacco products are target not only youth, but target minority populations who have the highest smoking rates and the highest rate of chronic disease. For just a short example, 86% of menthol smokers are African American. So the tobacco companies target these flavored products to youth and minority populations. So having this local law and a local licensing allows us to put as many different requirements as we want on that license in order to qualify to get that license. So it's a very powerful tool. And, it's not something that, there are political elements to it. There are economic elements. So when we try to do things like this, when we first got the law passed, what didn't happen overnight. We had to advocate. We had to build a constituency for it. We had to get community partners on board. We had to build, for lack of a better term, a movement to get this law passed. And now we will work on doing the same to amend it.
Awesome. Thank you so much, Vin. And, in this year, we're probably going to be doing some collective action work and calling on all of you to help us to educate legislators and the community at large about why this issue is so important. So more details to come on that one. And our other initiative with the lead agency of the Tobacco-Free Hudson Valley Health Systems for Tobacco-Free New York through American Lung Association and the tobacco dependence treatment is with working in federally qualified healthcare centers to help them work with people who have tobacco dependence and help them to understand there are resources that can help them to quit smoking. So we have a robust program through New York State 1866 New York Quits, and that program aims to offer free nicotine replacement therapy. When physicians prescribe these things, we know that the uptake is much better and that they might have more committal to, working to stay tobacco free. So there's a lot of details in that, and maybe we'll bring Khushbu back this year to talk more about the program. So another initiative on our action plan is our this is through the Ellenville Regional Hospital, CHIP, work with the Institute of Family Health and connect people to cancer screenings. We did see in the Sienna data that people didn't follow through with their preventative health screenings during COVID. So we got to get folks caught up on, checking for these things, because we know early detection does save lives. It extends your life and improves your quality of life. So that's on there. Additionally, we have a lead agency of the mental health department and their school support teams working with middle school students countywide. This was an article that was written up about the project in the Hudson Valley Health section here, but it's really fantastic because it allows the youth to set goals for their mental health improvement and connects them to services. So we really are excited about that project. And then another one with the mental health department related to substance use, overdose prevention, has to do with harm reduction, street outreach for opioid users, or anybody who's experiencing homelessness or, has a problem that they need to get connected with services. This is going to enable more people to be trained up in Narcan to ultimately save lives. So we're excited about these things. The last I'm going to just mention really quickly, because I know I'm getting close on time, is through Westchester Medical Center Health Network and the Health Alliance Hospital. One initiative that we saw terrible outcomes on pregnancy, maternal mortality. Actually, the death rate in Ulster County is not great. So we wanted to improve that through a multi-strategic approach in trainings with the doctors and really connecting these expected mothers with more services and working really closely with them and all of the people who are in that population that need special care during that vulnerable time in their life when they're giving birth. So that's going to be a really important initiative that the Health Alliance is heading up. And that's a quick overview. There's a lot to it, I know, but if you have any questions, Vin and I are happy to address them now.
Stace, can I just add a note here is that when people hear community health improvement plan, they may think that it's a comprehensive strategic plan for improvement. In other words, that it includes everything that's being done in government and through with community partners to improve the health of and well-being of the community. It's really not that. These are very highly targeted interventions, very select and highly targeted interventions that are being highlighted as a way of addressing some particularly poor health and behavioral health outcomes. So they're not comprehensive. They're highlighted and targeted.
Great. Yeah, absolutely. Thank you for pointing that out. We know that everybody in this room is doing excellent work and working hard on so many initiatives. We couldn't include everything. So, this is what we have for 2022 through 2024 this year.
We did that one year, and it ended up being 29 interventions in a 110-page document just for the CHIP.
And it still wasn't all inclusive.
So I want to remind everyone, if you have questions, please type them in the chat. And I guess one question that I would have, what happens so that everybody knows with the CHIP from here? I mean, at this point, you're monitoring things throughout the year, but maybe that's something that would be informative too.
Okay, sure. Yes, we're still collaborating with our partners and working to be a liaison. So as they're progressing through their deliverables, if there's any bumps in the road, we're helping as a team to address those. We're getting their data back on those different metrics, outcome indicators, so that we can report that to the state. And as we find barriers, we're addressing them and improving, the way the programs are moving forward. So we just are staying in touch with our partners to find out how things are unfolding and working through the challenges and celebrating their successes.
Great. Does anyone have any other questions? Just need to type them in the chat. Happy to put them out there. Sylvie Lundgren has a question. She said on slide 16, there was a data point about health disparities. She's curious to know what types of issues fall under the heading of health disparity.
Mm-hmm.
So I think it's more a general question on what does health disparity encompass for that?
Mm-hmm. Okay, yeah. Just trying to figure out which slide that was.
And while you're looking, I can address Christine's Noble's question. She wanted to know how to get a copy of the presentation, and the presentations are generally shared with me and they get posted on the CCE website, and that's also linked to from the Ulster County Department of Health website. So you should be able to access in about 2 weeks. It should be up there.
I can speak a little to health disparities. So in general terms, health disparities refer to situations where a particular demographic subgroup segment, such as, it could be age, it could be gender, it could be household income level, it could be ethnicity and race, where a particular segment, a demographic segment, experiences significantly poorer health outcomes than the general population or behavioral health outcomes. And, if you look at the data across the board, income is a huge factor. Like if you look at household income, the extent to which household income drops, chronic disease rates increase. And if you drop below $25,000 a year, which is basically extreme poverty level, the chronic disease rates go through the roof.
Great, thank you. Any other questions from anyone? I think we're all set with questions, and I want to just thank you so much for the presentation on the Community Health Improvement Plan. I know so much work went into that and really was dependent on a lot of folks in the room here today, just helping with the surveys. And of course, all of the hard work of Vin and Stacy that really went into that with, assistance from so many people. So thank you. It was a great presentation, and we do look forward to getting to look at the data. And I think that Katie put a link to it, the chip itself, in the chat, so you can actually look at the report. So it's already there. So we want to introduce our next presenter. So our next presenter is actually going to be Kristen Kessler from the City of Kingston, and she is the project manager in the Department of Health and Wellness there, in charge of and overseeing the Creating Healthy Schools and Communities project. And she'll be speaking to us today on a whole community PSE approach to making the healthy choice an easier choice in Kingston. So I'm going to let Kristen take over and share her presentation. And again, if you haven't introduced yourself in the meantime, put your name and your organization in the chat. That helps us also to take attendance at today's meeting. And we look forward to, again, start thinking about your questions as Kristen presents. You'll throw them in the chat and we'll answer them. And, we'll get to it there. Go ahead, Kristen.
Awesome. Thank you so much for that. Let's see. I'm going to share my screen now. Okay. Here we go. Oh my gosh, the same thing happened to me, Melinda. I had a different option when I practiced this earlier, that you would be able to see it. I'm going to try something a little bit different because I have two screens and I think that I can get us into the other one. Okay. Can you see just the presentation now?
We can now. Thank you.
Fantastic. Okay. So that was fun. Thank you, Stacy, for a little bit of a preview of the Creating Healthy Schools and Communities program. So I will be going through and telling you a little bit about this program. We actually have some people I saw on this call who are a part of the team as well. So it's extra special if you have any questions at the end. I'm so glad that they're here. Let's see. Okay. Oh. There we go. So just a quick agenda. I'll give you a little bit of background. We'll probably fly through this because I feel like a lot of you are familiar with our programming already here at the City of Kingston. We'll talk about what the project is, do a little bit of a deeper dive into the different strategies that we have, and then there'll be some time for questions at the end. So the City of Kingston's Health and Wellness Department, like I said, I feel like I don't need to give a lot of context to this. It was created in 2018 with funding from a local organization. So we are essentially one big PSE program is what we do. So working towards making the City of Kingston a healthy place to live for everyone. You'll notice that I'm missing a colleague on here. It's myself who works there. Emily Flynn is our director, and Marcia Seabrook works for us. And I asked her for a photo a while back, and she didn't have a good one that she wanted to share with me. So when I was putting this together, I just came back from parental leave about a month ago. I realized I don't have a photo, so I'm going to make her do a photo shoot with me. So you can see that we have three of us who actually work here in this department. And out of this department, we coordinate the Live Well Kingston Commission, which is our objective is building a better Kingston to walk, bike, eat, play. So once again, back to this idea of PSE, so looking to facilitate policy systems and environmental changes in the City of Kingston. We have 6 focus groups. I think we actually might have a logo now for the Grow Well one. And if you're not familiar with those, there's a little link at the bottom, livewellkingston.org. I can definitely share that. You can always reach out to me. My email address will be at the end of it. But I'm going to go on with the assumption that most of you know about Live Well Kingston. So creating healthy schools and communities. This is a project that is from the New York State Department of Health. So the City of Kingston applied for this program along with Cornell Cooperative Extension of Ulster County and with the family of Woodstock as our partners for this grant. It was, I believe, it was before my time because I was hired to manage it once they received it. But we actually started the program last year. And when was I hired? December 2019. So we are in our second fiscal year of this program, and it's a 5-year grant. We will have this funding and this program going in its current state through May 2026. So it's exciting. So we've got a few more years ahead of us, and I think that we've already gotten a lot accomplished. I've listed on here some of the different types of PSEs that we might be working on. I also assume this group might have an understanding of what PSEs are, but just in case you are not familiar with them, a policy is a formal written statement. A system is essentially an informal process. It's kind of like the biggest difference between a policy and a system is the policy is something that's formally written. And then the environment, it changes to like the physical environment, like are we putting up posters, the economic or social environment. So we work on things like, a healthy vending machine policy for systems. These are just examples that our partners who work with us can choose from, but this is the kind of the work that we do. I'll get into our specific strategies afterwards. Here they are. We've got, I always say 5. It's interesting. I feel like we have 3 target audiences that we work with. We work in the communities, we work in schools, and we work in early care and education centers. And with those 3 target audiences, we have kind of these 4 big buckets of work, and this 5th one that kind of hangs out that I put like a little cloud. It should be more like an arch or like a rainbow above us, because it is communications and sustainability. So it is how we are communicating to our community, how are we communicating to legislators and so forth. So it's kind of like we take all the work that we do in those little squares underneath, and then we communicate it and we figure out how to do a sustainability plan. So food service guidelines, that is supporting community and work sites to create and implement their own food and nutrition guidelines or policies in their food service venues. So a venue can be anything from a vending machine, it can be a cafe, it can be a food pantry. It's anywhere food is served, distributed, or sold is what a food venue is. And so that's one of the things that I work on. So I've got some examples after this, but I can work with all these sites, whether it's a worksite or community site. And we take a look at okay, you've got this food being sold. You want to create a healthier environment. What policy can we create? What kind of systems around that policy can we develop? And how can we change the environment so that it encourages healthier behavior changes? And then our second component in the community is with connecting routes to everyday destinations. And so that is the physical activity component. They also call it physical activity access, PAA, because they want to just confuse us even more on the way that they have named this program. And that is very specifically active transportation, but for people getting somewhere. So it's not necessarily just riding your bike for fun, although that's beautiful. And I know there are many other ways that we encourage that. This program is people who ride their bikes from home to school or home to work or work to the library. So this idea of different routes that you're going, so one destination to another. And then school nutrition, physical activity. This is Ninette is on the call from Cornell Cooperative Extension of Ulster County. She works with school officials, staff, and parents to improve policies and practices in the school environment. That was a short description. She does so much. So I don't want you to think it's not a big project, but it's almost too much for me to explain here. And then early care and education. Tracy, I know, is on this call as well from Family of Woodstock. And so she essentially does very similar things, but she does it in the early childcare settings. And this ECE, as we call it, is really a lot about a train-the-trainer sort of model. And so she goes in and she trains the staff and the volunteer, and she shows them how you can engage the kids in different ways to increase physical activity or to get them excited in nutritious food. And like I said, lastly, it's a pull communications with sustainability. How are we intentionally and thoughtfully communicating with the community to support behavior change, as well as working with people who have these positions of power to make these policy changes for us? So, it's how can we work with, for us, I think the Common Council for the City of Kingston. How can we work with Senator Henchy's office? Thinking through how can we work with folks who make these big policy changes that will affect us on the local level. So it's a big project and a lot of work. We have 3.5 more years till the end of our grant period, and hopefully we'll continue on with the work afterwards. So I have this one, this is modified from my recruitment presentation for food service guidelines. So it gives a little bit of a deeper dive into it. When I work with sites, we establish the food and nutrition standards that will help to promote healthier options. But we also look at supportive strategies and behavioral strategies. So we really make sure that all of the work that I do, I just met with a site earlier this week, and I kept telling them, I will be here for TA. I will be here to guide you and provide a structure for your work, but all of the solutions and the answers will be coming from you, because it is about what is of value and what is importance to your community. And I don't know that because I'm not here. I'm here to help facilitate. I'm here to provide some resources. I'm here to provide some evidence-based practices and so forth, but you know your own community. So I'm going to ask you what is important to you, and then we'll develop it from there. So that's sustainability, equity, celebrating cultural vibrancy and diversity in their community and their food, the local economy. They all share that with me. And then we couldn't just develop a policy without actually putting behavioral strategy changes to it. So we can't just have a piece of paper and be like, yay, we have this piece of paper, awesome, we have this policy, without thinking, okay, how can we promote it? How can we help to encourage these behavior changes so we can actually see impactful change? Oh, I think I see some things in the chat. Let's see, are those for me? I haven't been able to find, oh no, Stacy just put in some links. Okay, I'll ignore that. If you work with me, the food service guidelines will probably be a 9 to 12 month process, because I do a really extensive assessment as a part of that. So someone was saying in a presentation yesterday, we go slow to go fast. And so we do a lot of work in the beginning. We go kind of slow so that once we start to implement the changes, we can go fast from there. I don't want to take up all the time with just food service guidelines. The YMCA, we worked with their vending machines to get some healthier items in there. We're still working on that. We installed some water fill stations that we were able to purchase with HUC funding because of value and priority to them with increasing access to free water. So we installed those. Worked with People's Place to create a policy that prioritized things like produce, culturally relevant foods, and language equity. So we're able to purchase new shelves in there, new signage, kind of revamp the space to help them with their priority of bringing dignity back to the process of going to a food pantry, so that people didn't feel there's already stigma around it. They didn't want them to feel that when they were inside there. And it kind of helped to also promote the more nutritious items. It made the fruits, the little bins that we bought made the fruits look prettier and more interesting. And they have little signs on the shelf that tell you these are the healthy options. We put this little great choice thing on the signs. And with Andy Murphy Neighborhood Center, we're working on the vending machines, and we also have a water fill station here. We're working on a youth advisory council. I don't know if it's going to work out at this site, but I'm still really interested in the idea of including youth voices in the decisions that are being made. For connecting routes to everyday destinations, we have our policy work. So the pedestrian bicycle master plan that Emily Flynn is project managing is going on. So if you want more information, you can go to engagekingston.com. There we have a consultant that's coming in and doing an assessment and creating a plan for us of how we can make Kingston more pedestrian friendly, more bike friendly. How can we encourage people to use those modes of transportation rather than just driving cars? And our implementation work, I called it the bike infrastructure project. We bought 38 bike racks that we are working on a plan on how to install those. A bike port. We did some safety education this past summer. And for those of you who maybe aren't familiar, we are doing a Broadway Prince landscape design project. So there's 2 green spaces that were created as a part of the redesigning of the intersection at Broadway and Prince. That's right across, from the YMCA, the Rite Aid, Dallas Wiener. And we just got conceptual designs from our consultants, which was really cool. They did extensive outreach this fall with high school students, with the YMCA Farm Project, with a group called Place Core. So it was parts of it were largely youth-led, and we'll be having a public meeting soon. So we'll definitely share that with this group, because we want everyone to be able to take a look at the design and provide their feedback, so that this is really, the designs of these spaces are community-driven they are what the community wants, rather than us just coming up with what we think is really great. We want the folks who are going to use it a lot to have input as well. Nutrition and physical activity in the school. So this is where Ninette shines. She does such a great job working with policies. She, I know is, I think, co-chair of the KCSC Wellness Committee. So helping on like the district level with the policy development, but then she also works in individual schools where she goes in, she works in a couple of elementary schools right now and helps them with their nutrition. She provides training and technical assistance, as well as some physical activity. And because I'm not the expert in this, I had her write program examples for me. So I could share that with everyone if you were kind of curious, like what happens in the schools. This might be a little bit easier to share the slide afterwards, rather than going through each of these little bullet points. But you'll see like at Edson Elementary, the goal was to increase physical activity. So they've done a couple activities around that. JFK wants healthier celebrations. And so they've done a couple of activities, the healthy celebration bin. And George Washington Elementary is also increasing physical activity. So it's it's physical activity and it's nutrition outside of the school meals that she works on. So that's why the whole idea of healthy celebrations is a part of her work. And then lastly, early care and education. This is Tracy from Woodstock, who does a great job. So she also goes into these EC providers and she helps to do an assessment of the work that they're already doing, and then makes recommendations on improving their policies, but then also very much improving the implementation. And again, this is both for physical activity and for nutrition that she's able to provide this resource for. And there is us. We've got, I put on here, if you have questions about any of these strategies, who to reach out to. I am for the program overall, as well as the individual strategies. And then Tracy and Ninette are in charge of their specific strategies as well. Whew. So I just haven't stopped talking.
Kristen, that was really great. We do have a couple of questions that came in through the chat, if you're ready.
Yeah, of course.
So Maria Reidelbach asked, do the food service guidelines apply to gas station convenience stores?
They do not, unfortunately. So corner stores were a part of CHISC 1.0, round one, and this time it's very specifically community sites. So it has to be like the Annie Murphy Neighborhood Center is a community site with a vending machine. The YMCA is a community site with a vending machine. It can't necessarily be like a retail location. Or like a business, I guess you could say. I don't know. I hope that helps to make the distinction.
Great. And Vin also has a question for you. When you work with the school and early care communities, is it all on site, or do you also work with families to help increase awareness and identify barriers?
I feel like Ninette and Tracy could jump in for those.
I can speak towards the school component. So one of the goals of working with the schools is starting a health and wellness committee at individual buildings, because right now there's a district wellness committee, but lacking at like the actual school buildings. And so through that, we do try to do as much family recruitment as possible, but I'm not specifically working with families outside of the school. It is mostly on site. However, I think Tracy is starting something with families. Maybe you could speak more to that, Tracy, if you're still on the call. Or else I can.
No, I am in the call. Yeah, I'm going to be doing a parent-child cooking class because as of right now, I really don't have a lot of interaction with families. I'm, in the early child care settings. So I just thought it would be a really fun way to get families involved and just, kids are creating and cooking their own meals. They're more likely to want to eat it and try different healthy things. So hopefully it'll take off.
Yeah, I think part of the project with the schools too, it also, Ninette serves as a liaison to get SNAP Ed and FNEP in the classroom as well. And then the hope is that they'll also be able to connect with families, and there will be based on what the wellness committees want, some, community kind of events as well. And you've already had the walk, bike, and roll day, which is, something similar. So
That's true. In terms of events that we put on, almost all of the events involve the families outside of school time too. It's just I'm not specifically doing like parent workshops. I'm more outsourcing that to our SNAP Ed, our FNIP, nutrition education, and stuff like that.
Right. Great. And I'm just checking the chat to see if there's any other questions. I think we've got them all. If anyone has a question yet, please let me know. You can just raise your hand at this point. Okay. That was a really great presentation and really comprehensive. And I thank you, Kristen. It was really great of Stacy to sort of set you up too in the chip. It just kind of rolled really naturally into your presentation. So it was awesome to actually learn so much about some of the interventions that are happening and how they relate to one another in Ulster County. So thank you. We're about to reach that part in our presentation. Let me just pull this back up. And we are at the movement break. And really, we're just going to do something super, super simple. And that's just sit up straight in your chair. And, you're just going to roll your shoulders gently back. Nothing that hurts. Just do it. 1, 2, 3, 4. Now rotate forward. 1, 2, 3, 4. And then bring your arms out. Hold them by your sides, take a deep breath in, and lift your arms up over your head, link them together, and stretch up. Gently tip to the right side. Take a nice stretch, breathe. Come back to the center. Go to the other side. I hesitate to use left or right because we're looking at each other in opposite directions. And then come back up. Take a nice deep breath. And bring your arms back down to your side. Just relax and shake them out and sit up straight. And yeah, remember when this meeting is over to get out of your chair, get up and really move around. That's really important. So I want to remind everyone that we do communicate through Healthy Ulster Google Groups. So most of you are already members of the Google Groups. I got a good look at who's at the meeting today, but if you are not, after today's meeting, you will be invited to be a member of the Google Group and you can communicate with each other there. I know that Stacy sends out a lot of information, meeting invitations come out of there for me, but remember, you're members of it. And as members of a Google group, all you have to do is put that address in an email and you can email each other. So you can get out information on your program to each other. Feel free to use it. That's what it's there for. And I also want to remind everyone that Healthy Ulster Radio airs Saturdays and Sundays. And if you are interested in being on that program, Stacy and Vin are really, really great to work with on this. And you can just reach out to myself or to Stacy or to Vin. Stacy has already put her email in the chat. I noticed she updated the chip in the chat too. So there's a new link to that. So go ahead and reach out if you want to be on the show. It's a great way to get your program out